Good evening, Minnesota. This is NUR 376 for all of your breaking pathology news. My name is Sam Master, and tonight we bring you a story of a man accusing his kidneys of making him sick. Kidneys are the filtration center of the body. Next to dogs, they are man's best friend. But what happens when they go rogue? A local man suffered acute glomerulonephritis when his kidneys triggered inflammation due to an immunological mechanism that damaged the membranes of their glomerulus. It led to a significant illness because that glomerulus is critical for proper kidney function. And it's the initial region where the blood is filtered. That damage led to the loss of vital substances such as albumin and potassium. Now, this local man is still with us, and we'll have him for an interview. But the main question is, could you be next? Whose kidneys will now go rogue? Welcome back, everyone, to NUR 376, Minnesota's Pathology News. We're here today with Local Man, who was diagnosed with acute glomerulonephritis. Local Man, how are you?
Thank you, Sam. I'm doing okay, given my scenario. I've been sick the last couple weeks. I found out a couple days ago that I actually had strep, which I was totally unaware of, so I didn't get that treated. And since then, I've just not been doing well. I've been really tired. I've been feeling super weak and really warm all the time. I've just been noticing like some swelling on my face, and I'm just not feeling good. All these aches and everything. So,
we have an artist's representation of that swelling because currently you've told me backstage that it was resolved. Is this an accurate representation of the swelling in your face?
I mean, I would say so. I think that's perfectly described. I've noticed that every time when I've woken up in the mornings, it's really bad. Like just all around my eyes here, and I don't know, super bad in the mornings though.
So, Mr. Mann, are you aware that that is edema and one of the signs of acute glomerulonephritis?
Oh, I guess that's what they told me at my visit, so.
Mr. Mann, you gave us some vital signs and laboratory values before you got on the air with us today. Is it okay if we talk to those now?
Sure.
Your heart rate of 105 and your blood pressure, that indicates both hypertension and an overworked heart.
I usually don't have hypertension. I've just noticed the past couple of times here that my blood pressure's been elevated, but I usually don't have hypertension. And my heart rate, I feel like my heart's been beating so fast these last few days. And my fever as well. I've been feeling super hot. Yeah, I'm feeling really warm right now still.
These are all indications then of your kidneys betraying you. We also have some laboratory values. Now, are you very familiar with the blood urea nitrogen and the creatinine clearance?
Not exactly. I don't know what the normal values are, so if you could explain that, that'd be great.
Your blood urea nitrogen and your creatinine represent how well your kidneys are doing their one job, filtering your blood. That BUN of 29 is far above normal of 20, and your creatinine should be 1.5 or lower.
So they're not filtering my blood, right? That's
your
what
kidneys
you're
have
saying.
betrayed you, Mr. Mann. Can you tell me how that feels?
It feels awful. I mean, they had one job and they couldn't do their job. What else can you tell me about these three?
Mr. Mann, now you brought a sample of urine in with you today, didn't you?
I did, because I was quite concerned with, I mean, look at this. It's so dark. It's this cola-colored urine, and this is my entire output for the entire day. Like, usually I'm going to the bathroom, like, several times a day, but I've just noticed my output's just been super low, and it's been super dark colored. So this is why?
Yep, your glomerular filtration rate and your output are far below normal. Another indication that your kidneys have betrayed you, Mr. Mann. Thank you for bringing that in today. You can put it back in the break room. Now, there's one last thing I would like the viewers at home to know and understand.
Okay.
Back tenderness. Is it okay if you stand up very quickly?
Yes, I have been having some back tenderness.
Now, Mr. Mann, I'm just going to hit your back lightly, okay?
Okay. Oh my goodness.
There you have it, viewers at home. Signs of renegade kidneys. Now,
My kidneys have failed me.
stay tuned. as we confront these renegade kidneys who failed at their one job. Good evening. This is Samuel Master of NUR 376, Minnesota's Pathology News, on site today to confront local man's kidney about these accusations of acute glomerulonephritis. Mr. Kidney. Mr. Kidney?
Oh no.
Sir.
What do you want from me?
Samuel Master, NUR 376. Sir, please stop.
I'm innocent. What do you want from me?
Sir, you are facing serious accusations.
I have no idea what you're talking about. What accusations?
Sir, are you local man's kidney?
No, I'm not.
Sir,
I don't know what you're talking about. I'm innocent.
are you the kidney of a local man?
Fine, I am.
Thank you.
What do you want to know?
You are facing accusations of causing acute glomerulonephritis. Are you aware of this?
No, I have no clue what you're talking about. I have not heard of this.
Sir, it's been accused that you have been refusing to filter the blood and failing at filtering the blood of local men,
I've been
causing
doing my job.
great harm, including hypertension.
It wasn't me.
Sir,
What do you
they're
want to
saying
know?
that you have gone rogue, that you are a rogue renegade kidney. Is this true?
No, I think I've been doing a pretty good job being a kidney. I don't know what you're talking about.
Then please, let's prove it to the viewers at home. Can you answer this question for us to prove your competence?
Okay, fine. What question do you have?
I would like you to answer this following question. Which of the following are not a sign and symptom of acute glomerulonephritis post-streptococcal?
I'd have to say those answers are coca-colored urine, elevated bun and creatinine, and mild swelling in the face and eyes. Yep.
Sir, you got 0% correct. Were you trying to deceive our viewers today into thinking that the symptoms that you caused, local man, were not due to you?
Of course not. I'm
You have a lot to
innocent.
answer for, sir.
I'm innocent. I don't know what you're
Sir?
talking about.
You caused this man a great deal of suffering. How do you answer for yourself? How do you sleep at night?
It wasn't me. It wasn't me. It wasn't me.
There you have it, folks. This renegade organ refused to take responsibility for its crimes. Thank you for joining us back here today. This is NUR 376, Minnesota's Pathology News, and my name is Samuel Master. In studio with me is an unnamed organ of Mr. Man. They've come forward as a whistleblower to talk about what exactly happened to this local citizen. Now, we're not going to use your exact name or your specific job within Mr. Man's body because you fear reprisal. Is that correct?
That is correct.
Thank you. But you do work in the cardiovascular system?
I do work in the cardiovascular system.
Excellent. Thank you. So we've seen tonight both confrontations with the kidneys themselves and some of Mr. Man's laboratory values. He had quite a high hypertension. Did that affect your work?
That did. My workload feels very heavy.
And the heart rate, did that also affect your work?
Yes, it has been affecting me. I'm getting tired.
Now, what was the root cause of that hypertension and high heart rate? Do you have any suspicions?
You know, I suspect it was the untreated strep.
The untreated strep?
Yes, I believe that it was the untreated strep, but I also think it might be the kidney's fault.
It was definitely the kidneys, correct?
I think it was, yes. Thank you.
Thank you. So what exactly did the kidneys do, or what occurred that could have caused this issue?
Well, they weren't filtering properly. The strep infection, he wasn't filtering it through, and so he just caused the inflammation and all the edema and my hard work, and I'm just tired. I'm sick of it.
And so you've talked to our investigators before, and part of that filtration issue is antibody antigen complexes. Is that correct?
That is correct.
And the kidney did not solve that issue, which caused inflammation. Is that correct?
Yes, it's his problem. And now I'm having to work for him.
And that low filtering, what would that cause?
That's causing me to work harder, which is I'm not working properly, and so there's edema and there's swelling.
And the contents of the blood, have they been affected, the contents of the urine as well?
I believe so. I believe there's been protein in the urine and blood in the urine and albumin, you name it.
And has that caused then you to be afraid that you will no longer be able to do your job?
I am afraid.
Thank you. If you should fail, what will happen to Mr. Mann?
I don't think Mr. Mann will be around.
Shocking and horrible news, folks. Thank you very much for coming into the studio today.
Thank you.
Welcome back, everyone. My name is Samuel Master here at NUR 376, all of your Minnesota pathology news. We're wrapping up a story tonight about renegade kidneys who terrorized a local man, causing him extreme misery and pain, as you saw earlier in this story. We have interviewed that man who brought in both a sample of his urine that looked like Coca-Cola. Let me show you. As well as confronting the kidneys who'd refused to take responsibility for their role in this issue, and talking to a whistleblower organ who bravely came forward to discuss the exact nature of what happened. As we wrap up tonight, the biggest thing that we want to understand is this could happen to you. You may be next. We confronted the kidney with a question that he should be able to answer fairly quickly. He couldn't. You will not get hypotension and increased glomerular filtration rate from acute glomerulonephritis. And you will not have massive proteinuria. He tried to use this question on camera to cover up for the fact that Mr. Mann had cola-colored urine, elevated blood and creatinine, and as the artist representation showed, swelling in the face and eyes. The biggest thing to understand is that we need to learn about this issue. We have to take responsibility as well so that we can protect ourselves from renegade and rogue kidneys. I'd like you all to answer this question really quickly, and I'll read it out for you. A patient who's experiencing post-streptococcal glomerulonephritis has edema mainly in the face and around the eyes. For you nurses out there, as a nurse, you know to expect that edema when in the day. Evening, afternoon, morning, or bedtime? The answer is in the morning, just as we saw with Mr. Mann. By the time we interviewed him that day, his edema had resolved, thus the artist's representation. Keep these things in mind if your kidneys should start to go renegade. Understand the root causes of this issue so that we can fight back against organs that go rogue. Thank you, everyone. My name is Samuel Master, and good night.